It's now my pleasure to hand over to the moderator for our next session, Ms. Onica Makwakwa. Onica is the head of Africa region for the Alliance for Affordable Internet. This is an initiative of the World Wide Web Foundation established by the inventor of the web, Sir Tim Berners-Lee. In her role, Onica works to develop effective collaborations across stakeholders in Africa with the aim of ensuring affordable internet access for all. She's an experienced advocacy, fundraising, and management professional with over 20 years of experience in the nonprofit sector, spanning various national and international organizations. And previously, she was the head of Office for Africa for Consumers International, where she worked with over 50 consumer organizations on several issues, including consumer digital rights. Thank you so much, Onica, for taking over.
Thank you very much, Shambi, and thank you so much for having this really important topic incorporated into today's program. As Mumbi has already challenged us, we have a responsibility and a duty to make sure that this call for including everyone does not just end with likes and claps on social media, but that we are indeed making sure that we are leaving no one behind in this digital revolution in a way also that is meaningful in terms of how it is utilized. We are going to now be discussing structural enablers and barriers to successful integration of digital health and in-person services. We've heard earlier today about how nearly half of the global population still remains offline. So there are still some structural challenges around digital access. And now we want to be able to incorporate digital health as well as in-person services to make sure that this access that we want for everyone is not just access for the sake of access or likes on Instagram, but it truly is access that is meaningful for people to be able to transform their lives. I am joined by a panel of 3 speakers, incredible professionals. I will start with Mr. Bakari Hardi Nyari, who is an experienced M&E specialist with over 14 years of experience monitoring and evaluating large-scale donor-funded programs, including for donors such as DFID, USAID, and UNICEF. Hardi has designed M&E systems and implemented programs across a range of health and environmental programs and has a unique understanding of constraints and obstacles to effectively evaluate, especially in sub-Saharan Africa. Welcome, Bakari. Please share your thoughts with us today.
Okay, thank you. Thank you for inviting me and thank you for the introduction. I currently work with the African Union Commission as the monitoring and evaluation specialist for the health and humanitarian department. And I'm also the focal person on digital health strategy for Africa. Digital health can improve healthcare by increasing access to health care services, bridging distances, and enhancing the experience of receiving and delivering care, especially to hard to reach and difficult areas. The COVID-19 pandemic has increased the need for digital health, with border closure, restricted movement of goods and services for healthcare, and increased the need to access information and documentation on health status of individuals using non-physical means. Digital health is going to be the way of the future if health systems are to be strengthened. The 36th Ordinary Session of the African Union Executive Council, held from 6th to 7th February 2020 in Addis Ababa, endorsed the digital transformation strategy for Africa. One of the critical sectors of the strategy is on digital health. Digital health shows great promise in supporting health system transformation. Some positive strengths include greater recognition of the importance of digital technology and the need for government leadership, including Ministry of Health in the process, reduced barriers, especially in the availability of mobile devices, including smartphones, decreased hardware costs, and better network connectivity. A clear focus on integration and interpretability of digital health solutions, including the importance of standards and focus on scale and increased awareness of the need for harmonized approach. Once there have been progress on digital health in Africa, barriers to scaling up some of the digital health intervention include weak infrastructure and device access, including reliable electricity, affordable high-speed broadband connectivity, especially in rural areas. It is worth noting that over 850 Africans still are not connected to internet, and there are many more who may be covered but do not use it. I mean, lack of sufficient and consistent funding for digital health is also another concern, and limited human resources and digital skills. It is within this content that the African Digital Transformation Strategy proposed the following policy recommendations and actions. One, support the development of the necessary prerequisite element to realize the full potential of digital health that responds to national health priorities and drive progress towards universal health coverage. To develop a digital health strategy that lays out a compelling vision and provides clear direction to health system stakeholders, assess the health needs of a country, and consider how digital health solutions can address them. Establish a strong leadership, intersectoral collaboration between ICT and health by putting in place an sectorial governance system with an action-oriented task force that advocates, advises, builds the capacity, and monitors digital health initiatives, and establish a robust monitoring and evaluation framework and harmonize key performance indicators across the digital health initiative. Put in place a regulation and policies needed to protect patient personal data and privacy to foster trust in digital health solutions and facilitate their adoption whilst allowing innovation to continue to unfold. Develop appropriate data privacy and data quality policies and regulation to enable digital health systems to support universal health coverage. Define policies for teleconsultation and e-prescription that allowing smooth integration with current clinical practices and address the ethical concern of professional medical bodies and patients for communicating the benefit and limitation of telecommunication. Ensure interoperability to allow the integration and leverage of different digital health solutions and data sources among government programs, hospitals, community health workers, and patients. Make interoperability a strategic priority and be identified in the national digital health strategy as prerequisites for success of digital health initiative. Set up a standard and interoperability task force to oversee standard selection and interoperability issues and help define the approach towards interoperability in member states, taking relevant cases into account. Under the leadership and the coordination of the Department of Health and Humanitarian Affairs, with the technical support from the Department of Infrastructure and Energy, as the overall coordinator of the digital transformation strategy, the African Union Commission plans to develop a continental digital health strategy with an implementation plan for consideration and adoption by its member state. A consultant has been hired. The baseline and mapping of digital health technology in Africa has been conducted. Various stakeholders have been brought together to form the African Digital Health Task Force. And this stakeholder comes from the regional economic communities, private partners, development partners, and other IT firms, representatives of other IT firms that operate in Africa. For the implementation of the digital strategy, both Department of Health and Humanitarian Affairs and Social Development would periodically engage partners and stakeholders to scale up the advocacy on development and implementation of digital health. The two departments will promote network of network by bringing together the global digital health community to address the use of digital technology to support early warning disease surveillance system, better preparedness, and better response to health emergency. The digital health strategy is also in line with the African health strategy, which has overall objective is to strengthen health systems performance, increase investment in health, support research and development of vaccines, medicine, and technology to address both communicable and non-communicable diseases towards improving equity, addressing social determinants of health to reduce priority disease burden by 2013. So basically, the African Union is in the process of developing the digital health strategy for the continent. And we are working closely with the regional economic communities and then the member states to come up with individual countries' digital health strategy. So in short, this is what the AUC is currently doing in the area of digital health. Thank you.
Great. Thank you very much, Hardi, for that intervention. You've reminded us of the 3 C's that we started on earlier today around community-led, connectivity, and the importance of collaboration. Now it is my pleasure to invite Dr. Joanne Peter. Dr. Joanne Peter is Johnson & Johnson's Director of Social Innovation for their Global Community Impact Team. Her work focuses on supporting and championing primary care nurses, midwives, and community health workers, and their connection to communities through the Johnson & Johnson Center for Health Worker Innovation. Joanne specializes in the use of health technology in low-resource settings. She is trained in medicine and international development at the University of Cape Town and Oxford University, respectively. She has spent her career in strategic philanthropy, including time with Google.org, the UN Foundation, and DGMT, working on a range of health, technology, and innovation programs. Welcome, Joanne.
Thank you so much. Right, so at the Center for Health Worker Innovation, much like many of you on this call, we often find ourselves just grappling with this major conundrum in global health, which is that we want to see universal health coverage with increased access to health services for half the world's population who are currently excluded. But we also know that we just don't have enough health workers. So the projected gap is 18 million by 2030, as I know others have also mentioned, and we just cannot afford to further burden those that we already have, knowing that burnout is at an all-time high following the strains of the pandemic. So unlike in other industries where there's a lot of fear about technology stealing jobs, in healthcare it's this major opportunity, allowing us to increase access to services whilst making sure that our most precious human resources for help are only deployed when they absolutely need to be. And this means that we really need to think differently about how health services are delivered and to ask ourselves, well, what does primary and community health look like in the digital age? And what will that new patient journey look like? And how do we ensure that it remains of the highest quality? So we've now seen during the pandemic many of these examples, like the great one that Marjorie shared from Mothers to Mothers, of hybrid service delivery, where clients are accessing a mix of virtual and face-to-face services. And I think this is the way that all primary and community care is going to be delivered in the future, with digital technologies being that very first point of entry into services. So I call it a digital front door to healthcare for every individual. But of course, why is this not yet the norm, and how can collaboration help? So I want to share just 3 points. Many of them are just a reiteration of the words of many of my esteemed colleagues that have already spoken today, but just hammering those points home. So the first is no digital access. So although phone ownership, it's now more than 5.7 billion users around the world, there are of course still digital divides that exclude people from access. And so a resource that I go back to frequently is the GSMA Mobile Gender Gap Report. They release one every year. And the 2021 report shows that although that gap is decreasing, there are still 234 million fewer women than men who are accessing the mobile internet. And in fact, access to digital transformation, it's now being referred to as a new social determinant of health. So there was a recent Lancet and Financial Times commission that made this assertion. And so there's a need for collaboration to ensure those foundational investments in network infrastructure and connectivity and digital literacy, as many have already mentioned. The second point is that there is no connected patient journey. So allowing that individual to move seamlessly from that digital front door that I described to the different tiers of virtual face-to-face service delivery, depending on their needs. So I think one of the questions in the Q&A alluded to this. At the moment, there are more than 50,000 health-related apps in the Google Play Store, and that number has more than doubled in the last 5 years. And if you add to this the enormous number of health-related websites and chatbots and messaging services, it's overwhelming. Most of these solutions are coming out of the private sector. There is no direct linkage into health services if a user should require a next level of care. And so this is really a confusing and poor quality experience for the user. And I think simply having access to all of these apps, it just does not meet the bar for universal health coverage. So there is a need for significant collaboration under the stewardship of governments to try and align private and public sectors and to create the conditions for a connected system which blends virtual and face-to-face care. So for example, I mentioned before, data standards for interoperability, unique patient identifiers for continuity of care, up-to-date registries of providers and facilities to support referrals, privacy and security policies, vetting, and where necessary, regulation of digital services to ensure quality. We also need a shared set of principles around the ethical governance of health data. And so actually, for those who are interested, there's a public consultation that's happening right now through a new coalition called Transform Health, and that's live until December 3rd. So if anyone would like to contribute to that, do look that up and make your voice known there. And then the last point I want to make is just that there's too little evidence of health worker and health system impact of client-facing digital services. So most of the research focuses on the client side. So looking at outcomes like increased knowledge or changes in behavior or health outcomes. But there's just a dearth of evidence which looks to what it means for the health workforce and the health system when clients are engaging with digital services first. So does this result in more care seeking, or does it result in less care seeking? Does it reduce the workload of health workers as intended, or as some have mentioned, does it actually add to it? Because they are now monitoring all of these new data sources from clients. So we really need to design and evaluate these new hybrid models of service delivery through the lens of many different actors in the system so that we can generate a complete evidence base for government investment. And this takes collaboration from a wide range of stakeholders. So that's health workers and technologists, researchers, donors, and governments. Thanks very much.
Great. Thank you very much, Joanne, for those interventions. And now we'll move over to our third speaker, Dr. Rajiv Ishwari, who is the Director of eHealth in the Gauteng Department of Health in South Africa. Innovative medical doctor with special interest in healthcare IT. He's got 38 years experience in public and private health sector, 13 years in India and 25 years in South Africa, with clear understanding of the health sector in developing countries. He's involved in healthcare IT for the last 16 years in South Africa and passionate about telemedicine, eHealth, mHealth, telemedicine and e-learning and health informatics with an intention to promote primary healthcare using information and communication technology. Welcome, Dr. Eashwari. You may please offer us interventions.
Thank you, Chair, for the opportunity. With your permission, can I share a few slides?
Yes, please proceed.
When I want it, it doesn't work. Give me a second.
Okay.
Yeah, it should be somewhere here.
share content with the green arrow faced up.
One second. I think it's somewhere hiding somewhere here.
Perhaps someone from M2M can share.
Sorry about that. Thank you very much once again, Chair, and the colleagues on the panel and the listeners. Thanks for the introduction, Chairperson. These are some of the points I'd like to touch as we go on. Let me start with the conclusion. Integrating the digital and personal for universal health coverage is not negotiable at all. We do not have an option. Digital transformation is here to stay. Digital health capacity are needed now more than ever. In this rapid change, hospitals, health systems, and other healthcare provider organizations around the world are building strategies to improve capacity. Capacity like human, financial, infrastructure, including hardware, software, and connectivity. And like Joanne was saying, that connectivity and bandwidth is a social determinant of health. So it is important that we have that sorted out. So building of new virtual care delivery models that ensure meaningful connectivity with patients when care is needed most. With so much information to sift through from every angle, building and implementing a digital strategy for your organization, it can be difficult. Healthcare providers need trusted framework and measurement tools to build and assess against as their transformation progresses. Just to emphasize what I said in the conclusion, let me show a few more slides. This is a very interesting slide. I like this slide because this is where I'm giving up my age, but this is what I did when I qualified. As a medical doctor, we used to sit with the patient, speak to the relatives, speak to the family, and then manage the patient. But we can't do that anymore for various reasons, apart from the human resources skills we have, apart from the pandemic. So those were the good old days where we could do house calls with the personal touch, and we used to emphasize on bedside manners. That's where we were taught when we were qualifying, chatting with family and friends. But with COVID times, it's a tele-video consultation where we provide remote support where we can, and started providing, and we are emphasizing on website manners, chatting with family and friends. We can still do it with technology. So post-COVID, we have to have a hybrid model that we have to look at both physical and remote support. This is just a slide to highlight the disruption that's going on in the health sector and the landscape of an industry that has historically been deliberate and methodical in its adaptation to change. The industry is transforming and it's happening fast. The macro trends that are disrupting healthcare are the technological innovations. I don't want to go into the detail. The previous speakers have highlighted some of them. Value-based care, in which healthcare cost reimbursements are being driven by the efficacy of treatment. The entrance of non-traditional players to the marketplace. I'd like to pause there and talk about what is happening. Even I've stopped going to a mall to buy things, to a grocery store to buy things. Everything is done digitally. So digitally native competitors eager to test drive their expertise in the healthcare domain. So we can actually get wellness and then medication from grocery stores as well nowadays. Although healthcare sector may be moving slowly in its response to the digital disruption, the rewards will be significant for those who respond to this market with speed and agility. The universal health coverage is a goal by itself. And that is what the national health insurance that South African government is planning to implement. The intention is to promote equity and efficiency to ensure all South Africans have access to affordable quality healthcare services regardless of their socio-economic status. The transformative technologies that are there, the fourth industrial revolution highlighted artificial intelligence, augmented reality, virtual reality, Internet of Things, wearables, 3D printing, robotics, biotic engineering, biotic technology, and mobile technology. So it's there, it's out there. We just have to start using them to improve. No matter what we do, I don't think we'll be able to cover the gap that we have from resources what are needed and what the resources that are available. This includes human resource and financial. And for this, I think it's all the more reason why we have to use technology to improve quality of care provided to our patients. The improving patient care outcomes will guide the way. Healthcare industry is one of the most highly regulated. Each emergent technology can introduce an entirely new set of compliance concerns, not the least of which the patient's data privacy. The intention is to protect the patient, improve patient outcome, at the same time prevent the provider, the physician or the nurses from getting infected with COVID. The strengthening of health systems to improve. This is a WHO framework, and we can see that information management is one of the key things that is required to make it work. Why is health system effective? And it's important. It's efficiency measures whether healthcare resources are being used to get the best value for money. Inefficiencies in any part of the health system leads to a number of undesirable consequences, including comparatively poor outcomes, and patient for non-attainment of the annual performance plan targets. These are some of the things which are quite important. We need to look at it in detail, but we have to be considerate of the time. So just have highlighted the medicines and consumables, health workers, healthcare services, inappropriate health facility size, medical errors, waste, corruption and fraud, health interventions, healthcare products and services. These are some of the things that is going to help us going forward, like triaging tools, the e-prescriptions, the digital pharmacies, the wellness thing, that wellness coaches or wellness apps that are out there in the market now. So you can go on and on, but I don't want to read each one of them. But there are opportunities out there. There are options available. We have to start looking at it. So in conclusion, integrating the digital and the personal for the universal coverage is no longer negotiable. We do not have an option. Being better is good, but being faster is even better. Disruptive innovation and decreasing product development times are happening in all industries, and now they have come to healthcare. I want to leave you with this cartoon in the sense that this is just to highlight the fact that we are here, but I'm sure we can get better as we go on. Thank you very much for the opportunity.
Wow, great. Thank you very much. And indeed, working from home is quite a challenge and an opportunity, as we've seen throughout this COVID period. So I'm going to invite our participants to please use the Q&A to drop some questions for us, or the chat box, so that we can give you an opportunity to engage with our panelists. But in the meantime, while you are thinking up your questions and developing something for us, I am going to ask Bakari in particular a question with regards to your work at the leading digital health strategy at the AU level. We currently have a access gap that is quite significant in the continent. But in addition to that, there's a user gap of people who do have access to the broadband connectivity, but are not necessarily online. And that's largely because of a skills gap. What is the collaboration between the entities that are responsible for the digital access strategy, as well as the digital health strategy, to make sure that, because digital health is a big part of creating that demand for broadband investment? And are you seeing that collaboration at the regional level as well as sub-regional levels to make sure that we actually can win in this digital health transformation?
Yes, there's a strong collaboration going on. As I mentioned, with the formation of the Digital Health Task Force, we brought people from private sector, the government, development partners, and even the member states. They are all part of the task force. And based on that, they share ideas and they are able to formulate policies in which they can create a conducive environment for such initiatives to be rolled out.
Great, that's great to see. I'm going to advocate for always including civil society in these collaborations. That's a trend that we are beginning to see, that we find is really important, that consumers have to now have a voice in this, because that's really who we are building these systems for. And we want them to be able to have an opportunity to consult and engage with us. But thank you for that. Now, Joanne, I would like to ask you, recently Jay has created the Center for Health Worker Innovation. And in your presentation, you mentioned an 18 million projected gap of healthcare workers. What are the opportunities for us to make sure that we can close this gap, but also meet the demands that are growing? Because I mean, that's a pipeline issue, I assume, but also an opportunity for innovating to close that gap and meet the demands.
Yeah, no, absolutely. When I think about that gap, I always say there are only really 3 strategies. The first strategy is that you need to train more health workers and bring them into the workforce. So you need to bring more health workers into the workforce. And part of that is also formalizing health workers that have been previously uncounted because they were informal. And often that includes community health volunteers. The second strategy is that you need to do a much better job of retaining the health workers that you already have. So supporting them so that they're thriving in their jobs and are not being lost to burnout and attrition. And then the third strategy is that you need to be much smarter with the health workforce that you have. And that's where technology can help us to really extend the reach and productivity of health workers. Make sure that health workers are only doing what only health workers can do. And that if something can be automated and task shifted to technology, we are doing that, because our very scarce, precious human resources for health should only be deployed where we need that special human touch. So I love that term of website manner. I hadn't heard that before. But yes, healthcare is very relationship driven and we need human beings for certain things. But where we can automate, we should automate. So the Center for Health Worker Innovation is exploring all of those strategies. But particularly relevant for this conversation today is how digital can extend that reach and productivity of health workers. And so we've been working with partners around the world, including Mothers to Mothers, to try to have advocacy and thought leadership in this space, to be investing with implementers so that we can test and learn and have a lot of cross-regional learning as well. And then also trying to build that crucial evidence base so that we can make the investment case. And particular aspect of that is that evidence base, not just for patient outcomes, but for health workers and for health systems who are often neglected currently in the research. Because I think if we're going to move the needle in terms of investment, we need to show that we're not just creating parallel systems that duplicate existing health services, but that we are truly creating these hybrid systems that extend existing services. Thanks so much.
Great. Well, yeah, thank you. And I think you've started to also answer one of the questions we've received from the chat, which is how do you see collaboration with public health systems and private sector with so many parallel apps sprouting up everywhere? And perhaps, Dr. Eashwari, you might try to take a stab at that one. Because South Africa certainly has quite a lot going on right now in terms of the mobile apps and SMSs.
That's quite interesting that you have actually raised it. We have, as Gauteng Provincial Department, we have developed an app called Impilo app. It's on the public domain. You can actually access it. Just go onto it, and then you can register and then get on. So that gives access of information, especially to our citizens, to say, okay, in case of a situation they require some kind of assistance when it comes to ordering an ambulance to come and pick up somebody who's not well, to finding the nearest hospital, finding the nearest clinic. So it is quite an informative app. I think you should actually, I encourage you to just log on to it and then check it out. So that is something that is required nationally. I think that is where we believe there is an opportunity. So National Department of Health is actually taking it up further and then making sure that that it gets reached to every citizen in this country.
Now, citizens in South Africa in particular, and this is true for citizens in most parts of our continent, have been complaining about the cost of data. From data must fall to all kinds of other campaigns around this issue of data. Quite frankly, consumers in this region spend close to 25% of their average monthly income on connectivity. So how do we make sure that they can afford data, especially when government entities rolling out these apps, right? How are you able to make sure that they are not only accessible, but that they're actually affordable to those who are able to use them? Because I think my fear is that with the number of apps that have been developed, we are continuously developing resources for those who can afford. And so that divide is getting even wider, while the whole intention is to try and bring everyone along to health services. So how are we, what is the position of the health sector around this issue of affordability for the platforms that are being utilized?
Thanks for that. It's a difficult one, but let me try and answer. The thing is, we are in the healthcare industry, not in transport or communications, but we strongly believe that we have to take a lead in trying to provide access. If you walk into a coffee shop today, the first thing before you order a cup of coffee, you ask them, do you have Wi-Fi? Isn't it? So there is no reason why we should not provide that kind of service to our community when they land up at our facilities. We should provide them with access to access to connectivity so that they can get information in real time. But what is happening at this stage is that we are having meetings with the National Department of Communications and ICASA and others, so that we can try and see how we can bring the cost down, especially for the health sector. And it has to be, Department of Education has got some initiatives that they're providing to the students, to the young kids when they go to the school. So I think that is what has to be extended. Most of the schools apparently have been given access to Wi-Fi. That's what I've heard, but I haven't checked it. So I'll be lying if I say they have it, but that is what is required. But we are busy trying to see if we can work with Department of Communications and then the comms there. But nothing comes for free. We have to pay them. So that is where we're looking at the Department of Communications to assist us, and ICASA to assist us with the process. We're working on it. Thanks.
Great, and I'm glad you mentioned the ICASA, because the ICASA is not just unique to South Africa. Every country has universal service and access funds, and we need to begin to advocate for making sure that these funds are actually deployed for public access, so that public Wi-Fi can serve those who are not able to privately afford connectivity, but also can serve as a supplement to those who can afford but are limited in terms of access to this. So thank you very much. I think that's really important. And perhaps this is the opportunity for private sector, including mobile operators, to come to the party around conversations of zero rating some of these apps. I mean, an app such as being able to call an ambulance, to me, seems like the kind of app that should be adopted for zero rating, so that whether you have data or not, it's just like calling your emergency line. You should be able to get through to that. I don't see any questions in the chat anymore, but I just want to give you, each one of you, an opportunity for some closing comments around disruptors and opportunities for making sure that we really get it together around digital transformation as well as health transformation. What are your thoughts? The last panel gave us some words such as access and magic. What are your words in terms of what you think should happen in the next 5 to 10 years to ensure that we actually this sector can be the model for AI and for digital transformed lives? And so what is the one thing that you believe should happen in the sector and collaborating sectors to make sure we achieve that? Hardi, we can start with you.
Okay.
You are sitting at the head at the helm.
Yes, so from AUC perspective,
yes,
we will ensure we provide conducive environment for digital health initiatives to roll out. Yes.
Okay, great, thank you. And what about you, Joanne?
So I just want to emphasize again this idea of a digital front door. That to me is this critical concept that every citizen should have access to a digital front door. And I, hear on the idea of zero rating and of, Wi-Fi hotspots in clinics to make that more accessible. But if we can have a single digital front door that is accessible to every citizen and is their entry point into a connected ecosystem of health services, that I think is the vision.
Great, thank you. Dr. Eashwari?
Unfortunately, one word will not be enough, but if it has to be one word, I like in the previous panel discussion, it said magic, because we have been in this space for quite some time and we have been trying and trying. We were not able to move, but fortunately or unfortunately because it's the pandemic that is taking lots of lives, but fortunately, it has actually brought technology to the fore. I think all the time we keep talking about negative things, but let us talk. Give me 2 minutes to talk about the positives that are happening. One of the things that we have been trying to achieve is to have digitization of electronic health records, etc., documentation. So we have been trying and trying. It takes a long time, and it needs a robust infrastructure to make it work. But one step at a time. We have achieved, as South Africa, we have something called the HPRS. I'm sure most of you would have heard of it. It's called Health Patient Registration System that generates a number for every patient who walks into any of our facilities. That is one. Second thing is we have this EVDS, electronic vaccine data system, that has actually made it possible to have an electronic record of every citizen in the country now. I mean, we are getting there. It's roughly about 55 to 60% of the patients who are registered on it, but we have a system where we can actually use that to our advantage going forward post-COVID. We have a national digital health strategy that has been approved, so we are busy trying to operationalize it. So I think that's where I'd like to stop. Thank you very much for the opportunity.
Wonderful. Thank you very much. Please give yourselves a round of applause. This was a really great discussion. I will leave you only with one word, and that is this whole day, I have been just inspired by the sheer amount of innovation in this sector. And I think my one word would be implement, relentlessly. Implement, because there will always be noise, there will always be reticence, but continue to forge forward. I think that we are sitting at the cusp of an opportunity to really lead digital transformation, with health being the leading opportunity for Africans and others everywhere to experience digitized lifestyles. Thank you very much, and over to you, Program Director.
Thank you so much, Onica. Thank you for the very impassioned and inspired session. Thank you so much to the panelists that did such a great job, so much sharing from just EU's commitment towards digital transformation to the innovations that are coming out of sort of the global community and impact from Johnson & Johnson, Dr. Joanne and Dr. Rajiv, the sound bites and really looking at what government is doing to be able to innovate and really look at eHealth. Thank you so much. It was a great, great session.